Good evening and welcome to a community conversation of the Lorentzsen Center for Faith and Work, a program of the Offutt School of Business at Concordia College. My name is Per Anderson, Interim Director. Established 8 years ago, the center honors the life and work of Norman Lorentzsen, Concordia graduate, CEO of Burlington Northern Railway, regent of the college, and generous philanthropist. The center seeks to advance the integration of faith and work in support of the vision of the Offutt School, to contribute to the betterment of society by preparing ethical leaders who are confident, curious, and globally competent. This evening, we begin a 6-part series of conversations about good work and its future toward respect, engagement, and meaning. For each session, we will benefit from the perspectives of 3 panelists who will help us to think about work as employees, as employers, and as citizens. We will be informed along the way by social statements of the Evangelical Lutheran Church in America, particularly a statement on economic life, sufficient, sustainable livelihood for all, which calls responsible persons to seek good work for all people, especially the poor. Further, it calls for consideration of the future of work and to seek goodness for future workers. Good work for all today and for future generations. This is our agenda. Hopefully these conversations will help us to understand key questions, expand our moral worlds, and inspire us to contribute to the betterment of work. Before I introduce our topic and our panelists, allow me to share some thoughts about work. Work is universal and life-giving. It provides the means by which society produces many goods and by which people pursue economic livelihood and personal flourishing. Beyond livelihood and goods of society, work can enable lifelong growth, development of the whole self, and even religious meaning as a call to love the neighbor. Work then is basic to the human condition and latent with social and personal benefit. Unfortunately, the benefits of work are not widely experienced today. Only 1/3 of workers in the US report being engaged with their work. Most workers report lack of opportunity to do their best, develop talents and skills, and participate in workplace decisions. So we know, according to extensive polling by Gallup. So, good work is in short supply. Our conversation will address what work can and ought to be, proceeding with some assumptions. First, as noted, ELCA Social Thought commends conversation about good work for all persons, today and the future, a future that we create through our daily actions. Good work should not be understood as the privilege of the few. Bad work should not be viewed as the trade-off that workers must endure to participate in the consumer society. We will assume that most persons want more than livelihood from work, but that something more can be hard to find. And these difficulties will be understood as consequences of institutions and patterns of behavior that can be changed. Assuming workers want more than livelihood, we will consider how workers typically seek at least 3 personal goods: respect, engagement, and meaning, consistent with their human dignity and their unique identities. When persons expect work to affirm their dignity and support their identities, the workplace becomes a space of vulnerability and risk, as well as opportunity and gain. While people also seek these goods outside of work, they are right, I think, to cultivate them at work and to judge workplaces that disregard them as deficient. See the popular and quite painful comic strip Dilbert for more on this point. Our topic this evening, workplace safety for essential workers in the COVID-19 pandemic, offers an opportunity to think about respect at work, which arises from human dignity conferred by God, so the ELCA affirms. For the ELCA, employers should treat employees with dignity and respect through remuneration, benefits, work conditions, job security, and training. The pandemic has introduced a new lethal risk into the workplace. As an emergency measure to mitigate infection, governments have employed stay-at-home orders that exempt workers deemed essential to critical infrastructure. Similarly, many private sector employers allow or require some employees to work from home while expecting others to work in public settings with varying health risk. These in-person jobs are also deemed essential to organizational services and operation. So who are these essential workers? When the state of Minnesota undertook stay-at-home orders in April, 37 categories of work were exempted involving labor that renders critical services to society that cannot be done at home. These categories included healthcare, food and agriculture, emergency services, energy, and transportation. Across the US, these sectors represent over 1/3 of the 150 million people working today. Within this grouping of essential workers, analysts also identify what are called frontline workers, frontline industries, involving more than 30 million Americans who are assuming higher levels of risk. These industries include grocery, convenience and drug stores, public transit, trucking, warehouse and postal services, building cleaning services, healthcare, childcare, and social services. In addition to bearing higher levels of risk to provide essential services to society, these workers share notable patterns of overrepresentation. 2/3 of frontline workers are female, 77% in healthcare and 85% in childcare and social services. Women are similarly overrepresented in other occupations. People of color are overrepresented in frontline work at 40%. 17% of frontline workers are immigrants or new Americans. The percentage is raised as high as 59% in housekeeping services. 34% of frontline workers are over 50 years of age, while 16% are or live with someone over 65. Overall, 23% of frontline workers live in low-income families. More than 1/3 have a minor child at home. 1 in 10 frontline workers does not have health insurance. In sum, the health risk burdens of frontline workers are not distributed equally across the American workforce and fall disproportionately upon women, people of color, immigrants and new Americans, the poor, and the elderly, populations that, as we know, are also among the hardest hit by COVID-19. Some of these frontline workers are assuming risk by choice as matters of vocation. Some are not. We turn now to a conversation about the realities and challenges and needs of essential and frontline workers. We are privileged tonight to have 3 veteran professionals in public policy and human services with us. Paul Ossen is president and CEO of Minnesota Safety Council and board member of the National Safety Council, which provides national leadership of coordinated efforts to support safe reopening of the American workplace. Mr. Ossen brings to his work 3 decades of experience from numerous posts in city and state government and has professional education in environmental health. Janelle Regenbaugh is Vice President of Children's Services at Lutheran Social Services of North Dakota, where she has worked for 33 years in different capacities. Ms. Regenbaugh is a mental health professional who oversees programming that provides essential services to the public, particularly adolescents in need and at risk, and child care providers throughout the state of North Dakota. John Rewer has led Eventide Senior Living Communities as president and CEO since 2003. Eventide is a faith-based nonprofit with 1,400 staff serving 1,300 seniors at 7 campuses in Minnesota and North Dakota. Mr. Rewer is active in professional association work to improve senior citizens. He is a graduate of the Health Services Administration program at Concordia College. We will begin then with remarks from our panelists, followed by conversation between them, and concluding with your questions. Welcome, Paul. Thank you for your remarks.
Absolutely. Thank you. And it's a pleasure to be here. I am going to share my screen. So I have some slides I would like to show you. And part of my goal is to provide a perspective on safety from the macro all the way in then to this current issue that we're talking about with COVID-19 and essential workers. And then Janelle and John reflect, directly on their operational experience, and I can try to help, augment that with the perspective that we bring. But our name tells you something. We're the Minnesota Safety Council. We have a statewide charter. We were actually chartered by the legislature way back when the state highway system was being built out to promote safe driving. So that's why Drive Safe shows up on our logo. That charter was expanded rapidly to talk about safe workplace, safe living. And you'll notice that we are a chapter of the National Safety Council. The National Safety Council is a little bit older. They were founded about 1920. We've been founded about 1928. The National Safety Council was founded largely after the Triangle Shirtwaist Factory fire in Greenwich, New York. And that fire resulted in the death of hundreds of factory workers who were chained into their building. Their doors were locked to not allow the workers out and to keep them at their workplaces. So when you start thinking about this notion of a dignified and respectful workplace, you can see that safety is one of the main underpinnings of that kind of a workforce. And the federal OSHA, who we work closely with, actually has a charter and a regulation that's called the General Duty Clause, which is employers are to provide a safe place for people to work. Pretty simple and pretty straightforward, but we all operate on a whole series of layers of safety that we don't necessarily think about, and they all interact, ironically, and we're seeing them again now in this COVID challenge period. So this invisible safety net that we operate under is worth a quick look on the way in. This little guy is a kangaroo mouse. They're endemic in the United States, largely in the northern plains, so think Montana. This guy carries the bubonic plague, the Black Death. So Black Death lives in Montana right now, and it's lived there for centuries. Why aren't we all dead from the Black Plague? Well, it's because we have built over time a safety network of public health, other forms of safety that help protect us against an outbreak of the plague. We control rodents. We control the vectors that the rodents would interact with. In this country, we have clean water. When you think about disease as an issue in most places in the world, it's a waterborne disease challenge that we're facing. Not so here with us today, but we drink our water. We don't think twice about it. It's part of the safety net. We have product regulation in this country that makes it possible for kids to chew on toys, and we're not that worried about it, with the occasion of lead paint that occasionally comes in from Asia in a shipment that's not tested on the way through. So we have a safety net here. We have building codes. When's the last time you saw a building tip over in Moorhead, Minnesota, that wasn't tipped over because of a flood or a tornado? It doesn't happen. So there's a safety net in place for our buildings and for our day-to-day livelihood. Our roads are designed to keep us safe. This is the most dangerous road in the world in Bolivia. We don't have roads like this in Minnesota. Our roads have guardrails that are designed to keep from hurting us if we run into them, for example. So these are all layers of that safety net that we rely on way out, and then it starts to drill down. And we end up with the notion of what's safe then at work. I want to just show you a few seconds of this clip. When I show this to safety professionals, they gasp. Here you have a gentleman who's standing on the top of a brick wall while he's knocking it out, and the floors on this building have also been knocked out previous to this. And everyone in the safety world goes, that's crazy. What's that person thinking? What are they doing? This is one of those blunt reminders that we are still trying to get work done. And all of us are, on some level, work is job one. And that mission overrides, in some cases, safety. And this is a challenge that we're facing on a societal level right now with COVID-19 and essential workers. It's this notion of safety versus getting the job done. I think this gentleman should actually be praised for his mission focus, and then perhaps educated some about the choices that he might be making in terms of his own personal safety while he's trying to take care of his mission. You might think that that last clip was from somewhere in the Middle East, usual. This is a shot from Minnesota, from a residential development, and that's a contractor walking on the top of a 2-story wall with no type of tie-offs or equipment. So getting the job done overrides safety all the time, every day, across the country and across the world. Talk about living safe for just a moment. When you look at the risks we all face, these are the big 4: suicide, motor vehicle crash, falls, and opioid drugs. And these are in that preventable injury reason zone. This is worth keeping in mind because we are trying to work on top of this safety challenge. At the same time, we're trying to work and we're trying to get everything else done in our daily lives. Let's talk about driving safe for just a moment. This is a piece that Minnesota really needs to think about. Driving is the most dangerous thing we do every day, even with COVID-19 in play. Crashes occur in the metro area where you have a lot of cars. Fatalities occur in greater Minnesota. So when you're starting to think about risks and how you balance risks, you have to think differently in different places in the state for the driving part of that risk. And this applies for work driving as well as personal driving. So this is another layer of risk and safety that comes into play when we're trying to deal with something new like COVID-19. So if we're serious about having a safe workplace, then we would address infectious disease. This is where COVID comes into play right now. It's on the front end of the radar for everybody that we know. One thing that's important to note is that most of us don't have that much experience with infectious disease. Our grandparents and their parents, our great-grandparents, had a lot of experience with infectious disease. We have largely been isolated from it by these safety nets that I talked about before. So that's why this challenge feels a little bit different and a little bit harder. I just want to take you through the response that employers have taken. SAFER is an effort by the National Safety Council with input from a lot of different people to try to template how you should think about this challenge. In terms of a framework for thinking about an infectious disease, you need to think about where you're working. Are you in an office, a closed industrial setting, an open industrial setting, or a public setting? The risks are different and the exposures are different. And then you need to think about the physical plant and the physical interaction and the risks you may have there for contact, the medical ramifications of that contact, the stress and emotional and mental health impacts of living in a situation where you have this higher risk. And then there's also employment, legal, communication, and other factors that come into play when you're trying to develop a response to something like COVID. Layer in another layer. Over on the left side, you'll see that physical, medical, stress factors. You also have the relative transmission and widespread nature of the pandemic at a given time. So you move in this chart from pandemic mode with widespread transmission over to monitored and restricted transmission and long-term policy work. We're somewhere still in phase 1 of this chart. So this helps to reinforce the fact that this response is a long-term response. It's not like a tornado that blows through and then you can pick up. It's still traumatic, but this does not blow through and it's traumatic over a long period of time. What kinds of information is out there? What kind of work are businesses doing? They're building guidance. They're looking at checklists for how to operate their facility, how to safeguard their employees, how to deal with employees as they come to work, as they leave work, how to detect sick workers and try to encourage them to stay home and get care, how to deal with transmission and contract tracing, just like a societal transmission tracing, but it's all within the construct of their employer-employee relationship. One last item to ponder as we kind of come to a close. The traditional triad in the safety world is engineering, education, and enforcement. You try to engineer away, design away the risk. You try to educate people to change their behavior, and then you try to use enforcement to ensure that those other two things are occurring. We need to think about this triad when you're thinking about infectious disease. Number one is awareness, and in this case, COVID becomes a bigger risk. Mitigation of that risk. What can you do to reduce that risk? And what can you do to reduce in case of an infectious disease, your exposure and transmission of that disease? And lastly, and this is again where this societal conversation has to take place, what do we consider acceptance? We find it acceptable right now to say to a grocery store, you have to stay open so people can get food. That's probably reasonable because we all need food, but the workers that are in that store all of a sudden are put in a place where they're being asked to accept a risk that's different than it is in my office where I have people who can go home and work from home. So that's a new triad, two more ripples of COVID that I'm sure Janelle and John have had to deal with, and I think it's worth putting out there. If we're serious about a safe workplace again, you have to talk about impairment. And right now, impairment across our society is growing. It was growing before COVID. This teal colored line is the overdose, suicide, and alcohol-related deaths per 100,000 people. This is white non-Hispanics, 50 to 54 years of age, compared to the European countries that we're often compared to. Look at that rate change in this country starting in about 2007. We are not doing a good job of preventing overdose and alcohol-related deaths in this impairment arena in our field before COVID hit, much less after. And we are driving with more drugs in our system. This orange line is drug testing for multiple drugs in the bodies, in the systems of people who are involved in fatal crashes. So we have an impairment issue that's being exacerbated by COVID. And then, if we're serious again, we need to talk about fatigue. And all of us are suffering from forms of stress fatigue related to COVID and different kinds of meeting fatigue and work change fatigue and home change fatigue. And just as a brief illustration of what fatigue can do to you, this is some survey work from the late 2000s. They were finding workers who slept 5 to 6 hours had an injury incidence rate of 5. People who slept 8 to 9 hours had an injury incidence rate that was 1/2 that. So if you want to guess at what fatigue can do to your safety in your situation, it can change it dramatically. So you layer all these pieces in, and this is where we end up with this notion of the obligation of the employer to provide a safe workplace, and each of us working through the challenges of managing our risk and our relationship to that job to try to figure out if we're willing to do it and or if we're treating our employees the way we ought to treat them. So I will leave it at that, and I will unshare my screen and we'll turn it back to you, Per.
Thank you, Paul, for that look at the invisible safety net and the way in which infectious disease has come forward as something now that we need to be attending to. Many points we look forward to coming back to. Janelle, please, welcome.
Good evening. It's a privilege to join together tonight along with my fellow panelists, John and Paul, to discuss this important topic. I'm quite certain I will learn as much from these discussions as I will share. My organization's roots go back to 1919, when what was then called the Lutheran Children's Finding Society was formed to set up and support receiving homes for orphans, homeless, abandoned, neglected, and dependent children. My organization, now known as Lutheran Social Services, is a social ministry of the Western and Eastern North Dakota Evangelical Lutheran Church in America. Our work is rooted in the faith and values that underlie Christian service: grace, hope, mercy, restoration, hospitality, and love. Across the decades from the Great Depression to World War II, through the social changes of the 50s and 60s to the challenges of today, including the pandemic, our services have expanded to meet the changing needs of individuals, families, and communities. Through it all, we've committed ourselves to the people we serve, keeping the focus where it belongs, on our clients. The current situation of the pandemic puts stress on that like we haven't known before, and in a very different way. I've been fortunate to be a part of this social ministry effort for 33 of these 100 years. And during that time, there have certainly been many challenges that we've faced. But for me, the pandemic has proven to be the most complex, and I think in many ways, the most challenging. Primarily because it's experienced by all of us. There is no geographic respite. We cannot simply help our clients in maneuvering through the challenges presented. We are all simultaneously experiencing the same challenges, the helpers and those we help. The workforce challenges are vast. The balance of the need to serve those who need our help day in and day out, now more than ever, with the balance of keeping our workforce safe. The ever-changing nature of the guidelines as the science unfolds is but another complexity. And then there is the time frame in which we must persevere. Knowing this is the marathon of all marathons, not a sprint to the finish line, that we simply must toughen up and hunker down for a period and give it our all. Knowing better times are just around the corner. Know that special and added stress of the length of the duration of the pandemic places on leaders and all of management at any level of the organization is something we must be keenly aware of. How do we best support our workforce during this time, especially at a time when we must keep our distance? The unique nature of everyday life impacts, like some working from home, kids schooling from home, or the ever-changing schedules of the school hybrid, lack of childcare, and especially isolation from our natural support systems, all combine like a perfect storm of sorts that must be ridden out. Add to this the financial volatility related to the situation, and it's definitely not for the faint of heart. In the framing of this discussion, I want to share just a few key impacts with all of you tonight to add to the discussion and the consideration of what we see at the workforce, on the marketplace, and the overall delivery system of those things considered essential. Early on in March, I could assume my experience was maybe like many others in leadership positions. The saying, drinking from the fire hose, is often overused. I would say not in this situation. Like many, we too were engaged in moving those services and personnel that we could to remote operations and assuring essential services continued as always, 24/7 without interruption, despite the changes occurring. Again, not in one market, but everywhere at once. As a statewide agency, we had experienced the kind of impacts that occur when operations in one location may face a flood or a tornado, but now we had to make these adjustments everywhere at the same time. The rewriting of policy, procedure, and operating protocols were a large part of what was needed. What is the best guidance? How much does it vary by industry? Does the best practice for nursing homes or for hospitals and clinics compare to what we should be doing in a psychiatric residential facility for children or an alternative to jailing juveniles program? The often changing guidance led to an evolution of practices, all having to be implemented and revised over time, calling on staff to be in a constant learning mode and able to pivot repeatedly. Many of our policies and procedures have been revised multiple times in the past 7 months. One of the biggest stressors we all faced was simply decision fatigue. I think it was sometime in April when I took a break and attended a brief online seminar put on by Dr. Bruce Perry, an early childhood expert and a native North Dakotan. He shared lots of valuable information in this online seminar put on by his neurosequential network. What resonated most with me and my team members that also joined that video conference that day was when Dr. Perry talked about how the quality of decisions made while under significant pressure due to rapid changing environments was what we were all battling. It is what was bearing down on us with the weight of the world at times. During those times, we had to be keenly aware of analysis paralysis and recognize that perfection could be the enemy. We needed to get comfortable with the unknown. This is a time where resilience is a survival skill for management when it comes to being able to endure through the pandemic. Because of this constant decision-making, it became clear early on that what we needed to develop were several tools that would assist and streamline our work, such as decision trees for managers and staff based on the best guidance available at the time. During the past 7 months in our agency alone, we have a staff of a little over 300 people. We have had 135 COVID-related incidents to disposition. And when I say incidents, what I mean is situations where someone has had close contact or symptoms, and we've had to decide whether they can come into the workplace or not. Should they test? Should they not? It's just a staggering number of incidents to disposition, and the energy that takes, the decision-making that it takes. It really is the impact that this has on everyday operations that is a bit staggering to consider. During this time, personal and professional worlds have begun to collide. We've all been in each other's homes, met each other's children and pets, become more casual in our attire, watched people grow their COVID beards, go for weeks and months at a time without haircuts, you name it. The situation and our relationships within the workforce has changed because of the situations that we all have. And as a result of that, we've learned a lot more about ourselves and each other. We've learned more about close contacts and living situations, travel plans, and the like. It really, in fact, is an interesting blurring of boundaries, some of which is no doubt positive, but some which has created new challenges. Probably never before in the workplace have our personal decisions and plans impacted the safety of our colleagues and clients quite so much. What other part-time jobs our staff have, or whether they adhere to guidelines outside of work, impact us all. Central to our discussion this evening is the whole definition of what is essential. It seems the sheer duration of the pandemic has had a major influence on what we in fact consider essential. Early on, for us at Lutheran Social Services, in our wide array of service offerings, we initially envisioned our 24/7 services of our residential treatment center and our alternative to jailing juveniles program as the essentials other than our operations infrastructure. I think we now find ourselves realizing several things are in fact essential. We realize that we can only place things on hold for so long. Isn't access to treatment services for the problem gambler in effect essential? What about the supports for education and technical assistance for childcare providers, given that access to safe childcare is essential for the workforce? Or what about the lonely, homebound senior who is used to getting multiple face-to-face visits from their volunteer on a weekly basis? Essential, and the definition of it, seems to broaden over time. Doing without a variety of human services begins to have serious consequences. During the Great Red River Flood of '97, I became involved in disaster mental health work and in disaster recovery efforts, heading up with a colleague the FEMA-funded crisis counseling program for the Upper Red River Valley. The project lasted for a total of 18 months, an awfully long time by FEMA's standards at that point. One of the many things I learned at that time was the phases of recovery. And I'll draw your attention to a graphic that we'll share now that talks a bit about what that recovery looks like in times of disaster. During phase 1, which is the pre-disaster phase, it's characterized by fear and uncertainty. Disasters with no warning cause feelings of vulnerability and lack of security. fears of the future, unpredicted tragedies, and a general sense of loss of control over the loss of the ability to protect yourself or your family. On the other hand, disasters with warning can cause guilt or self-blame for failure to heed the warnings. The pre-disaster phase may be as short as hours or minutes, such as during a terrorist attack, or it may be as long as several months during hurricane season. So in the case of the pandemic, when did the pre-disaster phase of the pandemic even begin? That seems to be something we have great debate about to this point. Phase 2 is the impact phase. It's characterized by a range of intense emotional reactions. As with the pre-disaster phase, the specific reactions also depend on the type of disaster that's occurring. Slow and low threat disasters have psychological effects that are different from those of rapid, dangerous disasters. And as a result, these reactions can range from shock to overt panic, maybe initial confusion and disbelief, typically are followed by a focus on self-preservation and protection. So think about the shortages of products, the hoarding, types of situations we went through at that time. The impact phase is usually the shortest of the 6 phases of disaster. Phase 3 is the heroic phase. That's where there's a sense of altruism and many community members show adrenaline-induced kind of rescue behavior in some kinds of circumstances. But the heroic phase often passes quickly into phase 4. I think we can all remember, especially early on in the pandemic, maybe those warm feelings that came when maybe people weren't quite as attuned to how long this may last. In phase 4, the honeymoon phase is characterized by a dramatic shift in emotion. Community bonding occurs, optimism exists that maybe everything will return to normal quickly. The honeymoon phase typically lasts only a few weeks. And then comes phase 5, the disillusionment phase. It's a stark contrast to the honeymoon phase. During this time, communities and individuals realize the limits of help. As optimism turns to discouragement and stress continues to take a toll, negative reactions such as physical exhaustion or substance use may begin to surface. The increasing gap between need and help leads to feelings of abandonment. There may be an increased demand for services as individuals and communities become ready to accept support. This disillusionment phase can last months or even years, and it's often extended by one or more trigger events, usually including something like the anniversary of when the disaster first began. And finally, the reconstruction phase is characterized by an overall feeling of recovery. Individuals and communities begin to assume the responsibility of rebuilding their lives, and people adjust to the new normal, and the grieving of the losses continues. Oftentimes, reconstruction begins around the anniversary and may continue for some time beyond it. And following a catastrophic event, that reconstruction phase may last for years. So you may wonder why I shared this graphic of disaster recovery. But when I think about those reactions and I think about the process, those are a lot of the same things we're experiencing now and have experienced over the last 7 months and will continue to experience. I often stop and ask myself, now that we are 7 months into the pandemic, where are we in these phases of disaster timeframe? What can we truly expect from a situation of this duration? Will this period of disillusionment really linger for months and even years? And as an employer, what does this mean for us? And how do we mitigate for this? Not unlike I had to worry about mitigating post-flood when I dealt with all kinds of other issues that come with flooding. But the psychological toll and what you see before you in this graphic is not that terribly much different. Well, I know for certain I don't have all the answers, how to best respond in situations and how to balance both keeping our workforce safe and assuring our clients are assured of having their critical needs met, balancing physical safety with emotional well-being. But I do know that this will likely be one of those times that in my life and in the life of my colleagues, we will look back on as a truly defining time, the best of times and the worst of times all at once. When really at a time when it's sometimes incredibly hard to be human, we see the best of humanity. As essential workers lay aside their own needs to assure the needs of those who consider them essential are met day in and day out over the long haul of this demanding situation. I look forward to talking through some of these issues further as the conversation continues this evening. Thank you.
Thank you, Janelle. Thank you for, again, illustrating the absence of structure for the moment that we're in, and then helping us to locate where we are in that moment on the basis of similar kind of experience. That's very helpful. John, welcome and thank you.
Thank you, and thank you as well to Paul and Janelle. I pleased to be with these two on the panel and share some of our experiences at Eventide, where we represent probably a disproportionately large number of both essential workers and folks that are very, in terms of our breakout of both people of diversity as well as female and all of those groups that we talked about that are in this frontline caregiver work and probably underappreciated and certainly underpaid for the work that they do. We're not too far off pair where you started. We're just about 30% of our staff come from a diverse background, otherwise non-white, as well as nearly 88% of our staff are female. So we have always had special interest and sensitivity around the needs of childcare for our workforce, the needs of English as a second language for our workforce, and some of those things. And I think what I find interesting through this pandemic so far is the thought that, well, first of all, the surprise that I have that people are taken back that we had workforce issues. I think both our industry trade associations as well as anybody in the field, I think we've been pretty clear that this has been difficult and that resources don't allow for the flush staffing levels that I think everybody would prefer that we had pre-pandemic, let alone through the pandemic. The other thing that we've noticed is the little traces, and you see it come up in very subtle ways, but whether it's ageism or racism or any of the gender issues, those have all made their way into some of the discussions. I remember early on reading some of the, and a person shouldn't do this, but reading some of the comments around the stories, and I hated to be part of some of that in terms of, being one of the first to experience this in the Fargo-Moorhead area when the pandemic really hit in March. And that's, well, why is it that this virus is making its way into the campuses, and without visitation of family, clearly that is only one way, and that's staff. And why can't staff just stay right at the care center or right at the assisted living? So a real lack of understanding that our folks have families, our folks have needs. And so early on, just trying to work through the timeline. When this hit, there were certainly a lot of unknowns. And Janelle had mentioned all of the changing targets and changing information. That was happening not only daily, but literally hourly. So we looked to our CDC, we looked to our state departments of health for a lot of that feedback. And as we did that and we changed our strategies, communicated that to our teams, it wouldn't be but the next day something else would be added or changed. And that's a little bit of the fatigue. You're going to hear me use that word just like Paul and Janelle did. That happens is that the targets kept changing. And I think, we were hopeful at the beginning of this, we were going to start thinking about this event, much like we had flood and other crises, is that this was going to be days and potentially weeks, certainly not months into, beyond a year. And when that hit, it's again, there's all of those triggers that Janelle talked about. The only thing I go back to Janelle's graph earlier, I don't remember a honeymoon period. So if we have experienced that, I must have been asleep at the wheel because I don't know that we've been there yet. That said, I do know that we're starting to see with the community spread kind of this second wave. And I am worried about our workforce relative to not only the exhaustion, but now that schools are open. And I'm not saying by any stretch that we shouldn't be. But it is going to have an impact on, if not positive tests for our staff, folks that are being exposed to people who have COVID, and that means that they have to sit it out. So I think this round has been particularly difficult for good reasons. Number one, we've got more testing, but number two, we've got more testing, which means we might have more people sitting out out of our workforce for exposure. So that's been very difficult. A little bit about our diversity of workforce. Early on, we also started to hear hints about, well, does this, and we know that this disproportionately affects our population of color. But we also know that we have different living arrangements with a lot of our new Americans, with extended families, parents, grandparents, kids all living under one roof. And that's created some additional challenges. We talk about childcare. And for many of these folks, it's their parents or grandparents watching the kids while they're at work. So we have, in many cases, not only a diverse set of needs, but a special set of needs around supporting our workforce. The exhaustion also surfaced in the fact that when we talk about doing good work, even before the pandemic, we talked about this as a calling, because the hard work that gets done, the physical and emotional exhaustion, at $15, $16, even $18 an hour just doesn't, you're not there for the paycheck, you're there because it truly is a calling. And during a pandemic, many of the things that we derive joy out of our work, those things around helping our residents be part of life enrichment activities, being part of the communal dining experience and the visiting, and even assisting with family visits, all of that has been put to a halt. So we suffer right along with our residents and our families around those pieces that particularly in our senior housing were core to why we exist, were core to why people look to us, became off the table. Now I can tell you, in talking to a number of friends and colleagues, this perception that somehow what we do creates more trouble for seniors moving into older adult campuses is simply looking at it with only a single lens, because I know a lot of grandmothers and grandfathers, parents out there that are living alone are experiencing a level of loneliness well beyond anything that our residents are seeing. And so we've got a lot of public perception issues that we need to work through, which in turn creates operational issues, which in turn creates resource issues for us. So while we've been the beneficiary on the care center side of some CARES stimulus funding, largely that's been spent to early on. We were asking people to come in, sight unseen, whether you called it hazard pay, hero pay, gratitude pay. We've heard it called many different things, but what we were really doing is trying to find some level of compensation to show appreciation of the fact that people were coming in not knowing what they were walking into, and then going home not knowing completely what they were exposing their families to. So I know it's been overused. I certainly believe our staff think this hero thing has been milked to the nth degree. And although we may all feel that way, it feels a little disingenuous at times when that's great, so long as we don't have to think about that and we can still get to our family events, we can still watch the sporting events on TV. And so I was hopeful early on that one of the outcomes of this would be that we'd really have a reset on what it meant to be a hero and to have that calling and to be doing good work, and that somehow maybe our nurse's aide might be placed many steps up a professional athlete. But we sure aren't seeing that complete turnaround as of yet, but I remain hopeful that that's the case. Under the category of never waste a good crisis, because we use that one a lot around work, and we have, going back to the floods that Janelle referenced, and even most recently in Moorhead, where we helped relocate a number of residents from the Elam fire in Fargo, and the work that gets done, and the energy and the adrenaline, all those things, it's just so different with this pandemic, because it's, it goes back to Janelle's, we're these are all events that we knew the brighter day was right around the corner. We don't know exactly when this is going to happen, where things, well, we know one thing, it's not going to be business as usual. It's not going to ever be the old version of normal. And speaking of things I'm tired of, unprecedented and new normal are already at the top of my list. And I think all of our staff would agree on that. So we've got a number of things that we've done to make sure we're not, quote unquote, wasting a good crisis. And some of the things that I'd reference is there were things that we'd been looking at around just our programming. And we've had a really conscious effort to try to get to all private rooms in our care centers. And we've done that with anything new we've built. And now we were on the bubble because the need was there, things kind of keep moving along. But I tell you, during the middle of a pandemic, if you didn't think you needed private rooms before, you will now. And so we've even taken the action of downsizing some of our licenses to make sure that we've got predominantly private rooms. And we actually set a metric around making sure that in the next year or so, that number is nearly 100% all private rooms. So it's little things like that. It's also the creativity. We're in the process of building a brand new senior living building on our Moorhead campus. And a lot of the things that we used to take for granted about, maybe we'll share this space as part of the larger community. We're stepping back and we're relooking at how things are going to work going forward. So that and the use of our technology. The joke I like to share is we recently moved into a home office location, as most folks probably Moorhead know, across from the legacy Dairy Queen downtown. And one of the first things we did was be able to communicate with our campuses by having this really cutting technology, digital video technology. We went about 6 months without using it. And I thought, boy, what a horrible investment that turned out to be. And it wasn't until about early March we recognized that this was going to be a critical tool that we use literally every morning to do COVID updates. And one of the positive things that come out of that is, while we made efforts to connect and have meetings, the ability, even be it we're all tired of virtual, the ability for us to connect with our leaders, 3, 4, 5 times a week and go through these things together and set our plan of attack together has been very good. And even post-pandemic, I see some opportunity to continue to use those efforts. One of the things that we continue to struggle with, though, is how do we're used to having big in-person meetings. So if you can imagine even communicating with one area of the care center or an entire assisted living staff, in the past, we would pull those people together. And so we've had to be creative in terms of how we communicate messages, but more importantly, how we receive feedback. So we're doing a lot more pulse surveying in terms of where are we at. And we used to be worried about, well, let's get that score up because by golly, that's a reflection of management. I think we're kind of even past that and say, what do our people need? What's the issue today that we need to solve that can't wait till 6 months or a year when we would do the next employee engagement survey? So we're using real-time, quick question pulse surveys. Again, not rocket science, but something we weren't really clued into until we needed to be. And I can tell you it's going to continue to evolve because people are already telling us that with this really robust email communication system and the network that calls and says your test is today, people are tired of that. And so we'll have to continue to evolve how we communicate during and after the pandemic with a fairly large team, as I mentioned, or it was mentioned at the onset, about 1,400 staff members across 6 or 7 communities. And so we've got to be creative on that end of things. Speaking of testing, that's the next thing. So what we advocated for early and often was testing. We were fortunate early on in North Dakota that the state engaged with that, and we had regular testing, serial testing of our staff and residents, and that really helped us identify a number of folks that weren't showing symptoms, walking right through the front doors. And when that could be identified, our real ability to control the virus began. And Minnesota came around about a month later, and we had great success once we were able to get that testing in place. Well, now fast forward 6, 7, 8 months, and so now we're doing, because of the community numbers in Clay County, 2 times a week. So that finally dropped where we're doing once a week, but we do have testing fatigue, and we do have folks that are still terribly afraid and uncomfortable with the nasal testing. And so how long can that continue? And while we are, market friendly and trying to lead the way in all of our scales, I can tell you there's a lot easier ways to make a buck than the work that was done pre-pandemic. But then now start thinking about a face mask covered by a face shield, and in many cases, if you're working with a COVID, also with a gown. And so it's been very difficult work, made more difficult around the things that we're trying to do to protect our teams. So those are kind of in a synopsis where we're at. And I'd say also, just to kind of conclude my remarks, great concern around sustaining our workforce. Early on, we had a few folks that particularly are younger, maybe student workers, and we certainly understand that, had to back out right away. But I was so impressed with the number of people that stuck it through even before we had testing. And again, it's going back to the care and concern and the good work that they feel serving our residents. There's personal connections, as all of you would know, that are made every day with our staff and our residents. And so that was really the only thing we had to lean on. You can't cover that with a few bucks more an hour of hero pay or gratitude pay. Couple things around what we did to try to protect our staff early on, even as simple things like a hotel room so they wouldn't have to go home at night, so that between shifts we'd make sure they weren't going home and exposing other family members that might have underlying conditions. We have a number of things with our employee assistance program. We recently started an employee support fund that deals with some extraordinary needs that any of our staff might have. But I think that one of the things that we always have to weigh around this idea of making sure we're doing good is that if I could, I'd throw every amount of resources we can. And people have heard me say this, it's not news. I frustrate a lot of our other team members because it truly is a team effort. But I say, without nurses, the rest of us don't need to show up. And I firmly believe that. So without our nursing team, there really isn't a need for any of the rest of us. And I don't mean to undermine certainly the good work of any administrative team, housekeeping, culinary, you name it. But the fact is, that's where it starts. And they were certainly on the front lines. And one of the best things I can do is to make sure that as an organization that we come out of this, that we come out on the other side stronger, and that that opportunity to do good work and serve Eventide's mission continues going forward. So I'll just turn it back to you, Peter.
Thank you, John, for that insight into the complexity of what you face on a daily basis. At this point, I'm going to ask you to talk among yourselves. I do have a topic that I'd like to throw out if you'd like to look at it, but you can take whatever you wish. But right now, I'd also like to invite our viewers to discover the Q&A function on your screen and submit questions to my colleague, Carol Hedberg, and we'll start collecting some questions that we'll look at in about 10 minutes. The question that comes to my mind based on what you've said so far is that, you've all been required out of necessity to undertake work that no one else seems to be ready to do, and you know best how to get some of the critical work done. You're right there in the middle of it. But it seems to me we've had a lot, and you've talked about some of the stressors, but we've had tremendous societal conflict over this issue, right? And John, for example, you have an organization that works in 2 states. These states have had different responses in terms of their definitions or even use of the category of essential worker. We have a dispute going on about, who's really responsible for the political management and leadership in this. Is it a federal matter? Is it a state matter? We've essentially, I think, seen a state response system-wide as a country. Is that the way it should go? We hear, that the CDC and other organizations have great plans for how to address these pandemics, and yet, we haven't been able to actualize some of that envisioning, some of that structure, that invisible safety net that Paul has talked about. So I think our audience might be curious to hear you talk about how you've adjudicated between state agencies, federal agencies. Have they helped you? Have they gotten in the way? What part do they play in this whole picture?
Would you like me to start with that one?
Whoever wants to get us going, for sure.
Well, I'll just get started because I would say we remain grateful to our states, both North Dakota and Minnesota. I think in different ways have handled this as well as anybody can expect. There have been times I've been frustrated with both, but more often I thank God for the state response. if I'm being a little more critical, I would say the federal response, and this is not a partisan, this is fact. I mean, whether it's been the different FEMA related PPE equipment, whether it's was ridiculous to the degree that we had gowns that I've been quoted should be used to cover our flowers before a frost, not to be used certainly for COVID related work, but also all the promises. And so what we find is that we're going to send out the testing machines. They're machines that once you get them, the states have said, just park those because they're not near as good as the testing we're doing right now. And I'm still not sure how we're going to use those items going forward. So I think in part, it's such a big task that even at a state level, it's hard to manage all the logistics. So I'm certainly of the belief that there were things I would have preferred to be a little more federally managed. But I'm so grateful that the two states that we operate in have responded the way they have. The other thing I would look at is, again, I mentioned it earlier, how partisan everything has become. So we can't get to any place that makes sense because there's some agenda behind why it's being done and who's doing it. And that's been really frustrating for our team. And then also this kind of the early on feeling that how we fit into healthcare from an older adult services perspective was completely underestimated. All of the resources, all of the energy went into the hospitals early on. And it was a lot of us that, were under-resourced that were still, at the front lines. And there shouldn't have been any, I guess, confusion around that, knowing what happened in Seattle early on and that we were going to be the front line of this. So yeah, I would say that overall, I'm glad it was operated at a state level, but and the other thing too, I have to keep reminding myself, we've just not seen anything like this. So it's easy to be critical, and maybe what we all need to do is give everybody just a little bit of grace and say we're all doing the best we can, and we're learning as we go.
Janelle, Paul, thoughts on this?
Things come to mind, and I would echo some of John's sentiments. I think we're very grateful for the support that we received, some financial support early on. We're very grateful for Department of Health guidance and also guidance at the local level from our local public health organizations. And as a statewide organization, we of course have relationships with those entities at the state level, but also at the local level. And they've both stepped up in different ways. I think one of the things that I found frustrating is, I would call it some of the siloing of some of the access to resources and help has been locked in silos. Like there might be, as an example, maybe there would be some support or access to resources for, air handling systems and filters and those kinds of things, but they're just for hospitals, or they're just from nursing homes or whatever. And so I'm sitting out there trying to run a psychiatric facility for kids. And I'm like, well, hey, what about us? And then, you try to ask, we don't know anything about that, chase that down. So, you end up having to try to come up with solutions to break down those barriers rather than maybe at that state level or federal level, wherever those things exist, that those systems are talking to each other. Like, well, hey, if those air handling systems and those filtering systems are important in facilities, do we maybe care about, all facilities, or how do we work across those systems instead of, just hold out a resource for one or the other? Because we all have high-risk individuals in residential. And so there's been some differential approach. And certainly some of that is related to risk that comes with age and other issues, but that can sometimes get difficult to maneuver. And as our state and federal partners are overwhelmed as well, sometimes their ability to be proactive and reach out and help has been lacking. So you find yourself being the one to, reach out and ask for guidance or help rather than maybe have resources offered proactively, out there in the field. So I would tend to also agree that this is new for us all. And so I definitely sharing John's sentiment of it is it's definitely a time to step back and be empathetic. And I know one of my colleagues said it, and I've echoed it many times, that it's sometimes just a hard time to be human, you know. And so I remind myself of that ever since she said that. And so when I get frustrated with others, I realize that, you know, they're in it at the same time as we're in it. Again, the very unique nature of the pandemic. It's not just us helping people being impacted by this. It is us living through it ourselves as we're also helping others live through it. And it's tough to be a helper in these times. And so I think it would be the same way with decision makers and policy makers. They have very difficult jobs right now.
Paul, correct me if I'm wrong, but I understand that National Safety Council and Minnesota Safety Council try to be a bipartisan advocate for workplace safety, right? Is that fair?
Oh, absolutely, or nonpartisan advocate, if you
Nonpartisan.
want to, you know, it would also be accurate. Yeah, no, I mean, our missions are pretty simple. It's if there's a way to prevent injury or illness, we're interested. We're interested to make that happen, you know, and we're interested in promoting it and training on it and trying to help people move towards systems that will allow that to happen. And to I'm gonna step a little bit outside of the Safety Council and put on an old hat. I was the emergency management director in Minnesota in '97 and '98. I was on the ground in the Red River Valley, and my dad grew up in Hillsboro, North Dakota, so I know the valley reasonably well. And emergency management works best when there's a bucket model applied. So if you think about you think about a flood, for example. If there's a water leak in just pretend it's a bunch of bathtubs, but if there's a water leak in a factory, that factory has got the best chance to contain that water inside it. And if they can't, then the city brings their bucket and tries to put it outside that factory, whatever water is spilling out of that factory. And then if that doesn't work, the county comes and brings their bucket and puts it. And as you move to each layer, the resources actually become more specialized and more scarce. So in the state of Minnesota, there are maybe 2 bomb disposal trailers, but there aren't many bombs going off in Minnesota. So when you got one, if you can get that trailer there, it'll work. Well, in order to make that work, you need a lot of communication. And in any event that involves humans, communication and information management and dissemination takes as much energy and effort as the physical actions to control whatever it is you're trying to deal with. And in this situation, where we haven't practiced responding to infectious disease en masse, and Janelle hit it on the head, you got to, you know, this didn't hit one place, it hit all of us simultaneously. Then that means that task of communicating and coordinating just hit all of us simultaneously. And I would propose that the communication channels, for whatever reason, between all the layers were not robust enough to manage this, partially because we haven't practiced it, and partially because you had some of these other partisan issues that were laying into that dynamic. We know how to do floods. If you want a case study in how to deal with floods, go look at Crookston, Minnesota, and what they do every single year and how they coordinate from the block to the county. It's extraordinary. We don't have that for infectious diseases on a mass scale. We've learned it now, partially anyway, so we'll be better next time. But that is, I think, the reason there's this lag. And then when things go bad, people look up the chain, forgetting that up the chain, that bucket is smaller and more scarce and takes longer to get there. And so then nobody's satisfied because they feel as though it's been unresponsive. It's not intentional, but it is the human condition we find ourselves in.
We have one question that's come in, but before we go there, I want to give you a chance to ask some questions of one another that you're curious about or some points you'd like to follow up on.
I've got a quick question for both John and Janelle. So from the Safety Council perspective, we've had a chance to watch mostly businesses, and it's mostly the ones that have operated largely in the manufacturing and food sectors right through the pandemic. And I would characterize them as having, you know, on some level, they have a good grasp of the protocols and the practices that they're using right now to try to keep from outbreaks, causing outbreaks in their facilities. We're starting to talk about what's this look like and how do we maintain it for another 12 to 18 months. And I'm just wondering if you could comment on how you're thinking about that from your perspective, because you've got an environment that's harder to control than I do if I'm running a factory with a manufacturing line in it. And so I just would love to hear how you're starting to look forward and think about that long term.
I can start. I think we're starting to see it already. If we don't address some small wins or some small tweaking around what has been some pretty black and white responses to everything from family visitations, those kind of things. So you're already starting to see it, right? It's not just us. It's today in the paper opening up to full in-person education or even family visitations when arguably our community spread numbers are as bad as they've been through the pandemic. And I'm not taking any shots at that, because I think what we're learning, certainly, if not with our staff, certainly our residents, is that the cure could be worse than the pandemic, in the sense that we're creating loneliness and isolation, and people aren't able to see their families. And at some point, there has to be some give and take. There has to be some ability to live with some of this and manage it to the best of our ability. But that's been tough to do, because everybody's, playing CYA right now. I can't get straight answers from the health department, because if they give me an answer that says 14-day quarantine on any kind of trip beyond 24 hours, then that upsets families that think we're overreaching. And then if we pull back on that, we've got people upset that we're not doing enough. And so I just think, back to your bucket analogy, we have guidance. We have to be accountable for our own risk on what's manageable and what isn't. And so I think when we think about the next 12 to 18 months, this thing lingers on. I think we're just going to continue to see, how do we make those small revisions to be able to live with our cure.
One of our biggest fears early on, and it persists still today, is just the fear of staff shortages. We were short before, and now on top of it, you feel like you can wipe out an entire shift or two because of close contact and spread and having to do the right thing, and not bring people in when you don't have the adequate reserves to keep up ratios and the things that you need for quality of care. And so, that fear doesn't go away. I think we have learned how to mitigate some of the risk, and we've started to look at, and I think we recognized early on, you can't eliminate the risk. You have to mitigate it. You have to figure out how to not lose sight of the client and the client's need, and balance that with what you need to do around health and safety. And so, I'll give an example, like you talk in older adult facilities, visitation is of course something, but it is for us as well in a juvenile facility. I'm a parent of 2 adult children now, and I think about how awful it would be to have a 12-year-old living away from me who I couldn't go visit. It's no different than not being able to visit your elder parent. But I think, some of the understanding of a 12-year-old or a 10 or 11-year-old of the pandemic and why they have to be isolated away from their family and only see them on a screen for a period of time is a profound responsibility that we have to think all the time about decisions about home visits and visits of family to the facility. And so I think now that we see the length of time, and in the summer we started realizing that we had to pull back on some of those restrictions. We had to allow our children to have home visits, because ultimately they're going to be discharged home and they need the opportunity to practice what they're dealing with and be with their family. And we have to figure out a way to do that and work with families collaboratively about taking health and safety risks, and knowing how what they do at home impacts us when they bring their child back. And so it's really, I think, to me, one of the biggest shifts is originally as the pandemic hit and all the internal work that it was very much internal facing, policy, procedure, our protocols, all those kinds of things. Now, as time goes on, in order to survive and do more than survive and thrive, we have to look outside more. We have to recognize the systems that we live and work in and realize how what I do over here impacts what the detention center does, or what we do over here impacts what the family that child is being released to does. And, you know, I just got word today about a facility in North Dakota that's closing because of the financial really consequences of COVID. So here is a facility with a number of children living in it right now, where in the next few days, they're trying to make plans of where are those children going to go, you know? So, I mean, the consequences of not managing this well and dealing with some of the impacts financially and everything has that systemic ripple effect. And so I think at this point, we need to, for us to thrive and to continue to do well with dealing with this, we have to take that whole different approach now. And I think we have our internal work pretty well figured out. I think we're actually getting used to those changing protocols, and the decision fatigue is still there, but you become more used to it. It becomes maybe less taxing in a strange kind of way. So now we have to move away from the internal and make sure we are managing and collaborating well and communicating well with the systems of care, because we're all in it together. And we can't just focus on ourselves. We have to realize how what we do impacts one another.
We have a question here. Go ahead, Paul.
Well, I was just going to make just a kind of a quick tag on, and this is a real macro tag on, but under the header kind of this notion of dignity and respect at work, and more broadly, this notion of caring for humanity, we've got a direct conflict in this situation between a fundamental American belief, which is rugged individualism, and the need for a public health response, which requires collective action. And those two are in direct conflict in this arena. And that's part of what's driving some of the social and political polarization that we're seeing, is this conflict between these two concepts. And I think part of the challenge for us collectively is we don't understand that the quality of life that we all experience today is really based on a public health collective infrastructure that allows us to have clean water, clean air, clean food, good life, and live a long time. And that's not something that I earned because of my grit necessarily. And then I've got this American ideal of, you know, riding off into the sunset on my horse, and it's just me against the world. So I think there is an opening here for this conversation to occur differently in this country too, as the country quite literally matures. And when you look at older countries, they have a better collective response generally. There are all kinds of cultural and social issues around this, but it's an interesting node to think about and put on the table as we think about how you do something like this over long term. Heaven forbid COVID-19 mutates and we start to see waves of this repeatedly over a much longer period of time. So on that pleasant note, I will leave you for your next question.
Yeah, no, I mean, you know, Janelle has referenced this idea that we're going to hopefully move into this reconstruction phase, and I share your hope. That was my first hope when this all happened, that it would be a reprisal of social commitment to this kind of solidarity and collective action, because the conversation tonight has illustrated so well that this is a gap, you know, in the system because of the power of modern medicine and because of other forces that have prevailed. So this is a really powerful moment in our lives. We have a question from a viewer that wants to sort of look inside the life of the worker today, and, you know, sorting through all of the uncertainties about the workplace, all the conflicting messages, all the changes, all of that. has its toll. We've given it some names, but they want to know a little bit more about how you're helping workers to sustain themselves through the long haul and keep them their wisdom, their experience, their passion in play. That's a very real personnel problem, I'm sure.
I think we're really fortunate in the human service profession and the work that we do is that it really tends to be filled with mission-driven individuals. And probably in my organization, I have that other layer on top of that is people who want to work in a faith-based organization. Well, so, that's a lovely marriage, if you want to put those two things together and say that people have that mission of that helping part, but maybe on top of it have what comes with the faith-based aspect as well. And so I think in times of adversity and times of trouble, that's oftentimes what gets people through that. Their personal faith and commitment to doing that makes them go that extra mile, be willing to do that which is difficult, and basically make one decision at a time, one day at a time to commit and recommit to doing that when it's hard. I have to admit, you fear at what point does that become not enough? When can you not keep that up, because there has to be other things there supporting it as well. So things like employee assistance programs, or our organization is responsible for Project Renew in North Dakota, which is the free and confidential crisis counseling support system across the state. And so we're always trying to put that kind of information out there, asking people what they need and providing them with flexibility. We probably have been talking more in the last 7 months about, people's personal family needs and just what they need beyond their own individual needs and at work more than ever. And just asking about that, talking about it, asking managers to, hey, those things that you can control and make flexible, are you doing enough of that? Because that's really what it takes as the workforce is dealing with so many unique stressors. And so whatever small things you can do to help ease those burdens that everyone has, because maybe you can't, afford that hazard pay, or you just don't have a funding source to do some of the things that you want to do financially. You have to come up with other ways to do it. And to me, oftentimes it all resorts back to relationship, right? I mean, it all makes a difference in how you do the work. And how work is done is person to person. And so how your managers approach things, how you do as a leader, how those staff interact and have the ability to still get that mission-driven need from the connection with the client can't be lost, can't be forgotten about, can't be talked about. That's what feeds people ultimately in our work.
I would tag on to Janelle's comment. I have very little to add. I think we're in exactly the same place. The resources are limited. So beyond an employee assistance program, beyond the things that we do internally around the employee support fund that we're developing, and even the ability to donate PTO hours to an individual staff colleague that doesn't maybe have either they're new or they don't have the hours and there's a family issue or emergency that's come up. Those are the things that we're doing internally. I can tell you what it's not. It's not our federal CMS creating citations because somebody washed their hands for 18 seconds instead of the full 20. That's what becomes frustrating. So our best stuff is usually internally. One of our pulse questions, not unlike I'm sure many other places, is do you have a friend at work? Because of all the things that we can do externally or even from a administrative side of things, what gets all of us through the day is the relationships that Janelle mentioned with a coworker that help us understand we're in this together and create an ear to listen when needed, and that's the difference maker. So, and I can tell you though also, Janelle mentioned it, that direct supervisor, and I can tell you in our organization, like any, you've got good, bad, and otherwise, and we always see the best outcomes when we know that that direct supervisor is taking a personal interest in the lives of the team members. And so between that and having a quote unquote a friend at work, those to me are the two biggest drivers in terms of how we get through the day.
And I'll add just two items. Again, this is very much additive on what Janelle and John just said. But the workplaces that are showing best practices around trying to remove the stigma of seeking help for stress or mental health issues. So destigmatizing mental health care in the workplace is valuable. And then the other, Janelle talked about flexibility. I would add C-suite executive flexibility to this mix, because the need to accommodate different styles of working and accountability is stressing the C-suite, because in some cases, they're rather old school. There are some extraordinarily large employers in this country that have told their employees, you're not coming back into the office until the end of 2021. And there are other extraordinarily large employers that are saying, if you don't come back into the office, we're cutting your salary 10%. Strikingly different messages to those employees. And that's where the C-suite flexibility and thinking differently about how you do your work is absolutely critical, on top of the flexibility Janelle talked about.
Paul, I'm actually glad to hear you say that. We struggled as an organization that started on a single campus, which meant I was at A Street, our Moorhead campus. That's where I started. As we've grown, we've created this infrastructure, including a mini home office, where it's outside of the essential work that gets done every day on our campuses. And when it hit, there were a lot of discussion around, you know, because we still come from that camp that says all of us are here 24/7, and we show up. If you're not at work, you're not at work. And we just took a different posturing that we don't do anybody any good if our billing team is out with COVID or exposure. We don't do anybody any good if we don't have backup in terms of some of our nurse leaders to go in and help out when needed. So I'm actually glad to hear you say that. We've been struggling with that in the optics of, you know, an administrative office that gets to work from home. And we came back right after the 4th of July. Whether that's too soon or it was too long, I mean, we can debate that all day long, but it was something that we struggled with, knowing that our workforce essentially is 24/7 and the work doesn't get done unless we're there.
We're coming to the end of our time, so I'd like to throw out an idea for your comment as we conclude, and that is that, you know, you've really reflected from your long experience and how this is the greatest challenge of your professional career, and we're just at the beginning of it. It's a very, very difficult emergency that we find ourselves in. You've talked a lot about we're in the middle of this without the structure and the infrastructure that we need, and we hope we'll rebuild that, because this kind of infectious disease pandemic is not going to end with COVID. It's going to persist as long as humans interact the way they are in the modern world. But I'm also hearing you say that maybe this is a very powerful moment where the workplace could be humanized by the realities that the public and the private, the personal and the professional can no longer be so neatly separated. And we can't look at people simply as professional workers and leave their private life behind. That just isn't the way that it goes with us. Is that something that you've come to see, and that you're having maybe some of the most profound conversations with employees about what is the meaning of their work and why am I here? Is there a silver lining going on amid the anxiety, the struggle, the exhaustion?
I think so. I have to agree with that. I think everybody is realizing that working out of trepidation or fear just can't be sustained. But this notion of understanding the mission and then understanding how that mission fits in with the rest of your life mission is where you can find that sweet spot that allows both to happen and fulfill both. And that sounds nice and neat. It's never that neat. It's messy. But that conversation is taking place, and I think will continue to take place for a little while, because we aren't at the end of this by any means, and we haven't learned where next normal will be. Maybe John hasn't heard next normal too often as opposed to new normal. But whatever next is, maybe we can strike a different balance when we get there. And I am hopeful about that.
Last thought, Janelle, John?
Yeah, I'm an individual by background that's a mental health professional. And so the concept that is near and dear to my heart is always being strength focused, strength approached. And a big part of that is recognizing resilience. And I think one of the things that we're going to be learning more and more of is how do we as a workforce, how do we even as individuals continue to build our personal resilience and our collective resilience. It's not that we either are or not resilient, it's to what degree are we. And we can build upon that resilience, and experience in getting through situations is a part of that. And so this is by and large a very unique situation, just like I feel I am a better, stronger person from living through the flood of 97 and leading a project during the flood of 97. I take things away from that taught me a lot about how to persevere, how to do those types of things. And so we're able to see at this point in time the impact that has on people personally, and being a real person at work, and as leaders, letting people see the realness of relationships and to be able to sort through that. I think that's just a good thing we'll always take from this, that it maybe took a little bit of a crisis for some of those relationships to unfold that way.
And I would just add that we need to continue to work, and I think it was Paul that mentioned it earlier, around creating that level of respect that comes with being an essential worker. So whether it's our nurse aide working PMs, or maybe double shifts, or it's the teacher, or all of those professions that we're starting to learn we don't have a plan for how we're going to work without. How do we create that opportunity for stature for those positions that doesn't exist today? And I think from our end, it's just to be continuing to tell the story every chance we get about what it means to be a caregiver and answer that calling.
Paul Lawson, Janelle Regenbald, John, we want to thank you so much for your thoughtful reflections tonight. We here at the college try to follow some of the lead thinking in higher ed, and one of those big ideas is that the purpose of an education like we provide here is to prepare students for a world of unscripted problems. And that's what we've really been looking at tonight, and trying to understand our capacity, as Janelle said, to respond to these and to be resilient, to learn and to adapt to that, and not be overwhelmed by these things, but to also take seriously that they're out there and they're very complex, and we need to be ready for them. I think we've all been greatly enriched tonight as workers and as citizens, and I'm, again, deeply appreciative of the time and the thought that you put into your presentations. So you have helped us to launch a conversation that will continue next month when we look again at respect in the workplace and address the responses of American business to racism. Thank you to our audience tonight for joining us tonight and for your good questions. Good night from the Lorentzsen Center for Faith and Work at Concordia College. And above all, stay safe.